Good morning, Mr. Chairman, Senator Grassley, members of the committee. On behalf of the 2 million members of SEIU, including more than 1 million that went to work in hospitals, nursing homes, and people's homes, I thank you for the invitation. Our members recognize there are many economic challenges that you need to deal with that face our country, but we believe there is now a once-in-a-lifetime chance to finally address a strategic economic challenge that has been unsolved for too long, and that is to solve our healthcare crisis. The facts for workers in healthcare are very clear. 8 of the 10 uninsured go to work every day. Premium growth is now double or quadruple the size of wage growth, as you said, Mr. Chairman, and U.S. businesses are spending twice as much per person as their OECD competitors, and that is not good for American workers. But those are facts for the head. To get to the heart of the matter, there are people like Paula Hall, a child care provider in Spokane, Washington. In 2001, Paula was hurt working her husband was hurt working in a machine shop, lost his job, couldn't afford COBRA, didn't qualify for state aid because they made too much. So they played Russian roulette and went, like so many Americans, without health insurance. 4 years later, after open heart surgery, 3 angioplasties, and $250,000 in health care bills, they spent their savings, spent their child's college fund, lost their home, went bankrupt, and then finally got on state aid so they had health care again because they had so little income. Seems ridiculous in the richest country on earth you have to go bankrupt or be foreclosed or get a lower income in order to have a path for health care. And we believe, as all of the speakers said, if we're going to solve today and tomorrow's economic crises for working people and for our country, it is time right now to fix the healthcare system. Whether it's the economic impact of medical debt, and we should all appreciate as we deal with this debt crisis, there are now 72 million Americans struggling with medical debt, many of them who thought they had insurance that protected them. Another study says that medical debt will be the cause of half of the future bankruptcies in this country. But more importantly, when people don't have a sense of health care security, they're not going to begin to purchase at the levels we need to revive consumer spending. And when we look at what happened in retail, where it dropped an astounding 2.8% in sales just last month, we need people to be secure and feel like they can spend. With these kind of choices facing working people today, it's hard to argue that health care isn't tied to the immediate economic crisis. And if we do nothing, healthcare will only continue to fuel the economic crisis for years to come. We know, as you said, that the typical employer-based family health insurance plan will rise 84% to more than 24,000 in 2016. That'll collapse businesses' healthcare plans as well as employees' budgets. If we do nothing, we know, as you said, that we will double more than from $2 trillion to $4 trillion federal expenditures or national expenditures on health care, which is unsustainable. And as you said, federal spending on Medicare and Medicaid, now 4% of our economy, will grow to 6% by 2030 and 12% by 2050. This cannot continue. The single most important way to dramatically improve our economic and fiscal outlook is to take steps now to put health care spending on a growth rate more closely aligned with the overall economic growth. Now, here's the good news. As opposed to Senator Rockefeller said in 1993, I think there is a unique window of opportunity here. The voters have spoken clearly about the need for change. Business, consumers, unions, the insurance and pharmaceutical industries, I think, are all ready to participate in a process of real change. I think everyone now understands this is not a Democratic problem or a Republican problem. This is an American problem for families and for our businesses. And just like GM, if we fail to live up to our responsibilities and see the problems and deal with them quickly and responsibly, we will see the collapse of our healthcare system as well. We've begun to participate, as Ivan Seidenberg said, in many coalitions with many people who we don't usually agree with, but on this issue we totally agree, whether it's the Business Roundtable, NFIB, Walmart, Intel, Manpower, or the pharmaceutical industry. We believe the time has come to solve this healthcare crisis. That is why, Mr. Chairman, your call to action last week was so timely, so bold, and such an important step to move this forward. We were especially pleased to see strong support for accessing coverage, including the public option, strategies for cost containment, payment and delivery system reform, transparency, and more options for long-term care. The only way to fix this problem is not incremental, but fundamental, focusing on access, quality, and cost all at one time. Senator Grassley, we appreciate your long record of supporting policies that ensure coverage for all Americans. I'm proud to work with you on transparency and long-term care. Senator Rockefeller and Hatch have shown great commitment to these issues. Senator Wyden has obviously been a leader as well, and President Obama has promised us all that he will reach across the aisle. Now is the time to solve this problem. It is within our reach and can be done, we believe, in the first 100 days. Finally, let me just say, when it comes to the healthcare crisis, we have to take a lesson from the economic crisis. The longer we wait, the less we do, the worse it gets. And there are those who will say we can't afford to reform our healthcare system, but I say we can't afford not to. Thank you very much.
Thank you very much, Mr. Stern. I deeply appreciate that.